Hello everyone, welcome back to the channel. I'm Dr. Mira Tan, a board-certified urologist, and today we're diving into two topics men ask me about more than almost anything else. Why does urine sometimes come out in a split stream? And what really causes psychogenic erectile dysfunction? Plus, we'll address one myth that refuses to die. Do porn stars do something special to get a bigger, more dramatic split stream? Let's start by clearing the confusion. Split urine stream is more common than most men think. It happens when the urine flow exits the urethra through more than one channel, giving a forked, double, or scattered stream. Many men panic when it happens once, fearing something is seriously wrong. But the truth is, a split stream can be either completely harmless or a sign of something that needs attention. The most common cause is temporary adhesion at the urethral opening. After arousal or ejaculation, seminal fluid can dry slightly at the tip of the penis, creating a small sticky seal. When urine passes through, it hits this bit of resistance and divides into two jets. This is normal, temporary, and resolves immediately after washing or gentle wiping. No treatment required. Another common cause is morning urine, where natural skin oils or dried secretions slightly narrow the opening. Again, this is normal and disappears once the area is cleaned. Where things become clinically important is when split stream is recurrent, persistent, or accompanied by symptoms. For example, inflammation known as urethritis can cause swelling at the tip, changing the flow path. This may come from infections, irritants, or even friction-related inflammation. For older men, prostate enlargement can alter urine pressure and flow direction. A weak or divided stream can be a sign of prostate-related issues, so it's worth mentioning during a checkup. Finally, in rare cases, a split stream can result from structural changes like urethral strictures, where the urethra narrows due to scarring. This won't resolve on its own and needs medical evaluation. So if you experience an occasional split stream, don't stress. But if it's frequent or bothersome, see a urologist. The important thing is understanding the difference between normal physiology and something that requires attention. There's a persistent belief online that male adult performers use special techniques, exercises, or medications to create a bigger or more dramatic split urine stream. As a urologist, I can confidently tell you, this is a complete myth. And physiologically, it doesn't even make sense. Adult performers may appear to have more dramatic urinary effects because people see them shortly after intense scenes. After sexual performance, the urethra contains residual fluids. The opening may be slightly irritated from physical activity, and the pelvic floor muscles can be in a heightened state of tension. All of these factors can temporarily alter urine flow, but none of it is intentional or desirable. Another misconception is that porn stars somehow train the urethra or apply substances that change the stream. That's not only untrue, it would actually be dangerous. Introducing foreign materials, constricting the urethra, or modifying the opening can lead to infections, scarring, strictures, and long-term urinary issues, things no professional performer wants. In reality, the reason some men in adult films may appear to have unusual urine flow patterns is simply timing. Filming schedules can involve prolonged arousal, repeated ejaculation, dehydration, and muscular fatigue. All these temporarily affect urination. But again, this is not a technique, not a trick, and not something anyone should try to replicate. Also, adult content uses camera angles, cuts, and lighting to exaggerate certain effects. What you see on camera often doesn't represent normal physiology. That's why comparing your body to performers can be misleading and sometimes harmful. Now, what can affect how your urine stream looks? Hydration levels, pelvic floor muscle tension, temporary swelling or irritation, positioning, standing versus sitting. But none of these are porn star secrets. They're simply the natural variability of the male urinary system. If anything, what professional performers do consistently is maintain their pelvic health, stay hydrated, stretch, and avoid anything risky that could damage their urethra or bladder. So the takeaway is simple. Porn stars don't enhance or manipulate their split stream, and you shouldn't try to either. Let's move on to a much more common concern: psychogenic erectile dysfunction, something millions of men experience but almost no one talks about openly. Psychogenic erectile dysfunction, or psychological ED, is a form of erectile dysfunction rooted not in physical issues but in the mind. This doesn't mean it's imagined, nor does it mean the person is weak or flawed. It simply means the brain is the starting point of the problem. To understand psychogenic ED, you need to understand how erections work. An erection is actually a sophisticated neurovascular event. It begins in the brain with desire, arousal, or anticipation. The brain sends signals down the spinal cord, relaxing smooth muscle in the penis, allowing blood to flow in. At the same time, the veins tighten to trap that blood and maintain rigidity. But this mechanism is extremely sensitive to stress, fear of failure, anxiety, pressure to perform, and overthinking. The more you worry about whether you'll get an erection, the more your body shifts into fight or flight mode, raising adrenaline, tightening blood vessels, and making erections nearly impossible. This is why psychogenic ED can happen suddenly in men who are otherwise perfectly healthy. They may have morning erections, solo erections, or respond normally to stimulation. But during partnered intimacy, especially when they feel evaluated or pressured, the erection falters. Common triggers include performance anxiety, porn-induced unrealistic expectations, fear of disappointing a partner, stress at work or home, relationship tension, depression or overwhelming worry. Overuse of fast-paced pornography leading to altered arousal patterns. Psychogenic ED is especially common in younger men who are otherwise physically healthy. Many of them interpret one failed erection as a sign of a serious medical problem, which increases anxiety and creates a cycle of fear. The truth is, a single failed erection is completely normal for all men. But worrying about it afterward can turn it into a recurring problem. The good news: psychogenic ED is highly treatable once the underlying mental patterns are addressed. That's what we'll cover next. Treating psychogenic erectile dysfunction is about breaking the anxiety cycle and restoring confidence in your body's natural function. The first step is psychological reframing. Men need to understand that occasional erectile difficulties are normal and not a reflection of masculinity or attraction. Removing the catastrophic thinking often reduces the problem by half. Next is reducing performance pressure. Instead of focusing on the erection itself, couples can shift toward non-goal-oriented intimacy, touch, connection, and enjoyment without needing a specific outcome. When the brain feels safe and unpressured, physical arousal improves. Another extremely effective method is pelvic floor relaxation and breathing training. Many men unknowingly tense their pelvic muscles when anxious, which restricts blood flow. Deep breathing, stretching, and even mindfulness exercises help restore normal physiological response. Some men benefit from reducing or resetting their relationship with pornography, especially if the content they consume conditions the brain to expect extreme stimulation. A short detox or switching to slower, more realistic content can help normalize arousal pathways. Cognitive behavioral therapy, CBT, is one of the most powerful tools in treating psychogenic ED. Therapists help men identify the thoughts that trigger anxiety and systematically challenge them. After a few sessions, many patients see dramatic improvement. If needed, physicians can temporarily prescribe low-dose medications like PDE5 inhibitors, not as a permanent solution, but as a confidence-building tool. Once a man regains trust in his body, he often no longer needs medication. Lifestyle changes also matter. Sleep, hydration, exercise, and stress management all enhance sexual function because the penis is a vascular organ. It needs healthy blood flow and low-stress hormones to perform well. Most importantly, men shouldn't suffer in silence. Psychogenic ED is extremely common, treatable, and nothing to be ashamed of. Opening the conversation, either with a partner or a healthcare professional, is often the first step toward complete recovery.